All right, this is lecture 23, Microbiology. We're going to start with diseases of the urogenital system. Now, for the urogenital system, microbes typically enter through the opening of the urethra, where the urethra opens to the outside. And in terms of entry into the reproductive systems, in females it's via the vagina, and in males it's via the urethra. Which, if you understand your anatomy and reproductive biology, is a no-brainer. And here you see the female urinary tract organs, starting at the tip here at the urethra, and moving upstream into the bladder, and then the two ureters moving up into the kidney, the two kidneys on either side. In the side view, you see the reproductive organs here, the vaginal opening here, and the uterus with the cervix projecting into the upper section of the vaginal space, and then the ovarian tubes or fallopian tubes on one side, at least one of them, going up and arching over to end where the fimbriae are, just near the, not attached to, but near to the ovaries. In the male, you see the combination of both the urinary and reproductive organs, starting here at the urethral opening, going up the urethra through the penis, and then entering into this area here where you have the region that goes up into the bladder, just inferior to that, inferior to the bladder. Surrounding the urethra, you have the prostate gland in this area, and you also have the additional secretions of the seminal vesicles being added to that. From this point onwards, at about the level of the prostate, you have a separation of the two. We just went through the common structures that are common to both reproductive and urinary systems, but at this point here, let me change colors. At this point here, you have the change over to separation between reproduction and urinary systems. For the urinary system, you have the urethra continuing upwards to the bladder, and then going up, just as in the female, up the ureter to the kidney. And in terms of reproductive system, you have, of course, the prostate, and then the seminal vesicle, and the vas deferens or ductus deferens that acts as a duct for sperm cells from the testis. In terms of normal colonization of the urinary tract, urinary bladder by normal microbiota, there should not be any. There should not be any organisms in there. In fact, they are both normally sterile. Actually, the flow of urine helps this a great deal and continually washes out any microorganisms that manage to get in. In the female reproductive tract, there is a predominance of lactobacilli, which are non-pathogenic organisms, bacterial organisms present in the vagina. They're all part of the normal bacteria that are there. When you look at the urine, and remember, the urinary, as far as the urinary tract is concerned, there should be no bacteria. But if you look at the urine, and one cutoff is that if there's more than 1,000 bacteria per mil, which is a tiny number, or 100 coliforms. Coliforms are E. coli, Escherichia coli, and indicate some kind of infection typically. They're gram-negative organisms that should not be present there. If there's more than 100 coliforms in a sample of urine, or more than 1,000 bacteria, any type of bacteria per ml, that is indicative of an infection, a urinary tract infection. Urinary tract infections are abbreviated UTIs. They can be associated with inflammation of the bladder, which is called cystitis. And cystitis is more often occurring in females and fairly rare in males as compared to females. The usual cause of cystitis due to bacteria or bacterial cystitis is almost the vast majority are due to E. coli, Escherichia coli, but can be due to other organisms, including all of these enteric organisms, which are also present in feces, or could be present. These can all be enteric organisms, except the Pseudomonas, perhaps. So, but the vast majority that could cause problem, could cause UTIs, are typically due to E. coli. Now, sometimes that inflammation of the bladder can actually, due to a bacterial infection, can go spread further up the urinary tract, up the ureter to the kidney, to the renal pelvis, in which case it can cause inflammation, which is called pyelonephritis. Pyelonephritis is inflammation inside the kidney in the space of the renal pelvis, usually due to bacterial infections that, as I said, come up the ureters from the bladder, and therefore most cases start as cystitis, a bacterial cystitis. Again, E. coli is the usual cause of that, and sometimes, quite often it's happened. I don't do treatment, but it is quite often treated with Cipro, an antibiotic, ciprofloxacin. Everyone calls that slang Cipro. It sometimes is resistant. You get antibiotic resistance, and so sensitivity to different antibiotics testing may be required sometimes if you have a persistent infection of the urinary tract before effective treatment can be found. Okay, let's talk about sexually transmitted infections, or STIs. They can be prevented by the use of condoms, they can be treated with antibiotics. The first one we'll discuss is the first disease we'll discuss is gonorrhea, caused by the bacterial organism Neisseria gonorrhea, which can attach to the mucosa lining the urogenital tract, so the mucosal epithelium of the urogenital tract. It can also be found in the oral mucosa, and it attaches by its fimbria. That's not that important. We're not talking about the fimbria associated with the ovarian tubes or the fallopian tubes. This is a structure on the bacteria. In any case, it attaches to the mucosa of the mucosal epithelium. Females often are asymptomatic despite carrying being infected, and they can be asymptomatic more frequently asymptomatic than males. Males often infected with this organism would have pain when urinating and can have a discharge of pus from the end of the urethra. This kind of inflammatory infection with Neisseria gonorrhea is called gonococcal urethritis. All right. So there's many causes, potential causes of urethritis or inflammation of the urethra, but if it's due to Neisseria gonorrhea, then it's called gonococcal urethritis and can be treated with antibiotics. Untreated cases can result in more serious sequelae, meaning sequentially occurring signs and symptoms or disease progress, including, so you can see that it really, has to be treated, including endocarditis, meningitis, arthritis, and if a pregnant woman has this infection, it can infect the eyes of the baby when it's born by vaginal delivery, so ophthalmia neonatorum, which I've discussed before when we discussed infections in the eyes. So Neisseria gonorrhea needs to be treated. Here you see a photomicrograph of cells. These are, as you can see, hopefully multi-lobed nuclei, making them neutrophils. It's not a stain that you're maybe familiar with, but these are mostly neutrophils. It's an inflammatory infiltrate of phagocytic cells, and you can see the organisms inside. The organisms are typically arranged in pairs, so it's a diplococcal kind of arrangement. These are statistics from the United States. You can see the rate per 100,000. It's a fairly significant rate when you're talking about 0.5% of the population at this point here having the infection. 1 in 100 is 1%, and 500 out of 100,000. I'm sorry. 1,000 out of 100,000 would be 1%, and 500 would be 0.5%. So at some point here in the 70s, an era of free love, there was in fact a significant infection rate, 0.5% of the population in the United States. It's really serious. It has dropped off, but more recently there has been this increase. In Canada, this is not per 100,000, but is total numbers. In Canada, you can see that we also experienced here a large peak during the 70s, and that dropped off. But again, and even more clearly, there is a rising number of cases over the past few years. And we are not talking about a small number of cases, 30,000 cases here. These statistics come from the website that I mentioned in the last lecture. It's quite useful. It's a government website that puts together, and you can map out in graphs the incidence rate of all the reportable, notifiable infections that are occurring in the country, in Canada. Okay, so that was gonorrhea, the first notifiable the first infectious disease. We're going to talk bacterial disease and sexually transmitted infection. Not the large numbers, but not certainly nowhere near the same kind of numbers as you get with other things like chlamydia. Chlamydia trachomatis, and I've spoken about chlamydia trachomatis when we talked about diseases of the eye. It causes eye infections. So it is The cause of oculo, meaning eye, and genital disease, an important cause of sexually transmitted infections. 1.6 million cases in the United States in 2016, and over 100,000 cases in Canada in 2015. 70% of women are asymptomatic. You should understand that the problem with being asymptomatic is that these people, these individuals, can act essentially as carriers of the infection, of the disease, and spread it. They are unaware that they are infected. Approximately 50% of males are asymptomatic, a lower number, but still not an insignificant number. It is quite possible to have a chlamydia infection and not have any symptoms. If left untreated, it can result, so if you do have, sometimes you'll have symptoms and then go into a period of no symptoms, or vice versa, but if you have any symptoms, just because it's gone away does not mean that you're not infected. If left untreated, it can cause significant damage, particularly in females, due to pelvic inflammatory disease. Because of the anatomical structure of the female reproductive tract, there is a opening duct going, in the male, there is an opening duct going all the way from the tip of the urethra all the way back into the testes. But it is far more difficult for an organism to get up to the testes, or the area where the testes are positioned in the scrotum, as compared to in the female, where you have a pathway that is certainly more accessible than in the male, and you have a pathway through the vagina and up through the uterus and then the uterine tubes to opening into the abdominal peritoneal cavity where the ovaries are located. There's an opening between, there's an opening and an open space between the most proximal end of where the fimbria are of the uterine tubes and the ovaries. So organisms can get up through there and into the space of the abdominal cavity, resulting in pelvic inflammatory disease associated with infertility and chronic pelvic pain. High numbers, significant high numbers, more common in females than in males. Here are the kind of numbers that you find in Canada, and you should compare those numbers to the ones I showed earlier for gonorrhea, and you can see that there are many more cases of chlamydia in Canada than there are of gonorrhea. Both serious, have to be dealt with and treated, require treatment, and are increasing in incidence. Chlamydia, in fact, causes a number of different diseases. Remember that urethritis, inflammation of the urethra due to Neisseria gonorrhea, is gonococcal urethritis, and chlamydia is a causative agent, the infectious bacteria that causes non-gonococcal urethritis, which is the most common kind of disease that you get associated with chlamydia, but can also cause pelvic inflammatory disease, as I just mentioned. And when we talked about bacterial infections of the eyes, I talked about trachoma, a serious complication that can lead to blindness. You can get also inclusion conjunctivitis, also serious, infant pneumonia, and a unusual kind of lymphoproliferative disease called lymphogranuloma venereum. LGV, this lymphoproliferative disease, caused by chlamydia, can result in bacteria spreading through the lymphatic vessels and enlarging the lymph nodes, and is serious but treatable. Again, major cause of non-gonococcal urethritis is chlamydia, and the main initial signs, symptoms would be painful urination and discharge, a more watery discharge, as opposed to Neisseria gonorrhea, which causes gonococcal urethritis. Chlamydia is the major cause of non-gonococcal urethritis, but both of these can lead in females to pelvic inflammatory disease, can result in blocking of the uterine tubes, leading to infertility, and cause chronic abdominal or pelvic disease pain. Okay, so we covered two major sexually transmitted infections. The first was Neisseria gonorrhea. The second was chlamydia trachomatis. And here we'll talk about the disease syphilis. Syphilis, and these are statistics for the United States. And you can see three different graphs here. The thing is that syphilis has different stages. There's primary, secondary, latent, and then tertiary syphilis. You can see here, and this is the total number of cases, I guess. Yeah, total syphilis. It must include tertiary. Anyhow, primary, because it looks like it's more, this looks like it's more than the sum of this and this. Anyhow, the primary and secondary, you can see there. This is rates per 100,000. It's not as high in incidence as chlamydia or gonorrhea, but still significant incidence. What happens is the disease goes through a number of different stages. First, you have the primary associated with particular signs and symptoms. Then it moves on to a secondary stage, and then it can go into a long-term latent stage where you don't have any signs or symptoms, and in fact the individual is typically non-contagious, but then it can still progress and become quite damaging, causing large lesions throughout the body, which are called gumma. This is tertiary syphilis, not something to take lightly at all, and too late, I would hazard a guess that at that point there's not much that can be done for the person. Reported cases in Canada, total cases, again, you can see that there's certainly been a resurgence upwards for all of the different major sexually transmitted infections, gonorrhea, chlamydia, and syphilis over the past 10 to 15 years. There certainly is a rise. For syphilis, there was not a major peak in the 70s as for other sexually transmitted infections. It was associated with quite a high peak of incidence during the period of the Second World War, during and immediately after the Second World War. The disease is caused by an organism which is a bacteria, and it's a spiral organism. You can see it here, and it's quite a long bacterial spiral organism, and it is called Treponema pallidum. This is the organism that causes syphilis. It invades the mucosa of the urogenital tract, the vaginal tract, and enters through skin breaks. Or enters through skin breaks into the person's tissues. Diagnosis, typically, actually, the usual test is the VDRL test, which stands for, strangely, I think, but this is a test that has been around for decades and decades. It's stands for Venereal Disease Research Labs. How that name came about exactly, I don't know, but it's long-standing. Since I studied microbiology as an undergraduate many decades ago. Can't believe how many. Okay. There you see, this is immunology type of test where antibodies that have antibodies against the organism that are tagged, and the antibody molecules are tagged with green fluorescent dyes that will fluoresce under UV light. So you add the antibody to a sample and then incubate for a while, to wash away any free antibody, but any antibody that's stuck onto if the organisms are there in the sample, any antibody that sticks on will then fluoresce. That's one kind of test. I don't believe that's the VDRL test. Syphilis, as I said, has several stages in the progression of the disease. The primary stage is typically involved with a lesion at the site of infection. So in the in the genital area in the female, on the penis in the male. The secondary stage is associated with widespread rash, or not widespread, but rashes that can occur in different parts of the body, not just around the genitals, mucosal and skin rashes. Then it can go into a latent period. I told you, as it progresses with time, it can go into a latent period where there are no symptoms and not transmissible, but that does not necessarily at all mean it's the end of the disease. It can then go to the tertiary stage, in which you get large, severe lesions in many organs, leading to death. Treated with penicillin. If it occurs in a fetus, if it's transferred into to a fetus congenitally, which can occur, it can cause severe neurological injury. So that's gonorrhea, chlamydia, and syphilis. Those are the three bacterial infections, sexually transmitted bacterial infections that can affect the urogenital system. Here are some websites that provide useful information. I think I've actually put these up before. They might be useful to you at some point. Morbidity and mortality weekly report, all the notifiable diseases, all communicable infectious diseases are listed. Data is listed here on a weekly basis. Let's move on. We're not going to talk about these. All right, let's go to, we'll discuss now viral diseases, viral infections of the urogenital system. But I think it's also a reasonable place to stop. So this would be the end of Lecture 23, Part 1.